Now in this section, we'll be dealing with the hypostasis. Hypostasis is basically the early changes after the death. And it is one of the early changes after the death. And when I say early, it means within 12 to 24 hours after death. So what this section deals is with an overview of the hypostasis, and then the color and distribution of the hypostasis. That has a lot of medico-legal significance, basically. That will basically establish the time since death, the posture of the body after death, and that will basically determine the condition of the person who was dead, the pathological condition of the person, and the atmospheric conditions in which he was. So the hypostasis versus the bruising is discussed in detail, and the absence of the hypostasis points towards a lot of things while we crime investigator case, and so we'll be discussing that in detail in this section. So the changes of the hypostasis. Now the changes in the appearance of the skin which occur after death due to the movement of the blood under the influence of gravity. So it is due to the gravitational forces that all these changes occur in the dead body. It was a misconcept previously that all of these changes occurs due to the coagulation of the blood, which is not the underlying cause of the appearance of the hypostasis. The underlying cause is basically the gravitational forces that come in action. And as the blood vessels loosen up after death, the blood becomes stagnant in the vessels, and so it gives a characteristic staining to the skin. So that is basically the whole definition of the hypostasis. Now the lucidity, staining, or cogitation, livor stasis, livor mortis, all of these terms are used for hypostasis. Different people use different terminologies, and all of these basically point towards the same phenomena. Now, what it basically looks like, not in all cases, but in most of the cases, the hypostasis is bluish red discoloration on the dependent parts of the body. It's not on the independent parts of the body. It's apparent between 30 minutes to 3 hours after death. And the areas which are in direct contact with a firm surface do not exhibit hypostasis. For example, the sacrum. It doesn't show the hypostasis because it is in firm contact with the bones. After about 12 to 24 hours, the lividity becomes fixed. And how do we basically establish it? That is discussed in detail later on. The blanching test, which is the mainstay of this phenomena, which will establish whether the lividity is fixed or not. Now, why is it important to note down whether it is fixed or not? It will point towards the time since death. What we have to keep in our minds is the post-mortem lividity starts 1 to 3 hours after death. It is completely established between 3 to 6 hours after death, and it becomes irreversible after around 8 hours after death. So if we perform the blanching test, and the test is reversible, it means that less than 6 hours have passed since death. And if the blanching test is irreversible, it means that the post-mortem lividity is fixed and more than 8 hours of death has been passed on. So as I've already told you that in most of the cases, a normal hypostasis is reddish or bluish in color. But there are a lot of cases which will signify, it helps basically in determining the time of death, the poison of the position of the body after death, the cause of death, as we can see in these cases. Now, the case which is shown on the first slide is basically the case of the hydrogen cyanide poisoning, which will give a bluish tinge to the postmortem staining. And the second slide, the postmortem lividity is cherry red in color, which will basically point towards the carbon monoxide poisoning. So the hypostasis, the color of the hypostasis can point towards the cause of death. The time of death is calculated, as I've already told you, 1 to 3 hours, 3 to 6 hours, and more than 8 hours, there will be a fixed lividity. So that will basically help in determining how much time has passed on after death. Now, the position of the body after death, because if the person is moved, in the phase when the post-mortem lividity was reversible, then we'll not have an established post-mortem lividity, and that will indicate towards the positioning of the body after death. Now, the distribution of hypostasis. Now, the distribution of hypostasis, what will it indicate? The body is lying on its back, in this case, and it compresses the vascular channels. The hypostasis was prevented in this case. After sufficient time, the hypostasis distribute itself accordingly. So these are the points that we have to keep in mind. The initial pattern that is made and how it is fixed basically shows us how was the body and what vascular channels were prevented and what vascular channels were compressed on that position. So that is basically, in this picture, it is showing that the body was lying on its back. So these are the different patterns. It's basically showing that the type of clothing the person is wearing, that is also signified in some cases. The body remains vertical after death. If the body remains vertical after death, the post-mortem lividity usually is found on the lower parts of the body, for example, the legs. The hypostasis is most marked in the feet, the legs, and to the lesser extent on the hands and the distal part of the arms. The pallor of the supporting areas, the local pressure can exclude hypostasis and produce a distinct pattern in contrast to the discolored areas. Now, the color of hypostasis, I've already shown in some of the slides, differ in different types of poisoning cases. In case of carbon monoxide poisoning, it gives a cherry pink appearance. In case of potassium cyanide poisoning, it gives a pinkish red appearance. In cases of nitrate and aniline poisoning, it gives a brownish tinge. In cases of anoxia, it is bluish discoloration. In hypothermia, it is a pinkish hinge. In sepsis with Clostridium perfringens. Now, Clostridium perfringens is normally found, is a normal bacterial flora of our body and our guts. And it is quite highlighted in cases of septic abortion, and that we have to keep in our mind. And in these cases, a bronzish hue will be given to the post-mortem lividity. Now, in cases of the methemoglobinemia, a brownish red tinge is given. Now, hypostasis in other organs, a lot of other organs, for example, the internal organs, are also in stasis of the blood. It causes the confusion as to the cause of death. Blood collections at the back of the neck can be mistaken for being result of the manual strangulation. So if you found hypostasis marks on the neck, it can be confused with the manual strangulation, and that we have to keep in our mind. Now, what is the difference between the hypostasis and the bruising? That we have to keep in our mind. Hypostasis basically occurs on the dependent parts of the body, and the bruises can be occurred anywhere. Hypostasis have well-defined edges, whereas bruises do not have defined edges. Hypostasis, blood is retained in the intact capillaries, and blood escapes through the ruptured capillaries in the bruises. In hypostasis, we have a superficial discoloration, and bruises, we have discolorations which are deep into the skin, and that is basically the cellular reaction that is occurring. Hypostasis occurs at the same level on the surface, and bruises are slightly raised due to the inflammatory reactions. Now, the hypostasis are pale over the pressure areas, and bruises are reddish in colors due to the inflammatory reactions again. Now, hypostasis, if we incise the hypostasis area, the blood flows from the cut vessels, and in bruises, if we give an incision, the blood coagulates in the tissues. There is no swelling in the hypostasis, whereas in the bruises, we can find swellings in those areas. Now, on the picture on the right, basically showing the blanching test, which I was talking about. It's basically to determine whether the post-mortem lividity is fixed or not. Now, the absence of lividity. In a lot of cases, we can find there is no lividity, there is no post-mortem lividity. Now, what can be the causes due to that? The patient can be anemic. Maybe he's suffered from an exsanguation prior to death. Individuals with highly pigmented skin, we do not have very marked lividity in them. So that was all for this section. In this section, we discussed the post-mortem lividity in detail and what are basically the medico-legal importance of this post-mortem lividity. What other conditions can be confused with this post-mortem lividity? We have kept that in mind. And what are the basically tests to perform to basically determine the time since death? Thank you for watching sqadia.com.